Unlike mainstream orthopedic medicine, I find that most orthopedic disorders are joint derangements, mechanical disorders in joints that can be remedied by moving the joint that's affected into the one or two directions it needs repeatedly. And that's usually the only form of treatment, although sometimes there are ancillary types of treatments. But I need to find analogies for a lot of people because they've never heard of this concept before, because it's not regularly taught or preached in the medical world. So one analogy I'll use with patients is that a mechanical joint derangement is like the everyday cold. Now, they don't overlap in every single criterion, of course, but there is a lot of overlap, and a cold is something people are familiar with, so kind of comparing the two makes it easier to digest. Like everyday colds, I argue that mechanical joint derangements, whether it's in the neck, the hip, the ankle, they are going to happen once in a while. They're going to happen because you're living a life that includes forces and positions on your joints all the time. And you're going to get a cold every once in a while. You're going to be around people who are sick. You're going to come in contact with germs. You're going to have a weakened immune system for a period of time. So if you understand that these things are relatively common, that decreases the fear and increases the understanding. Like colds, however, with mechanical problems in joints, we can do prevention strategies. We can try to reduce the risk of getting a cold or a derangement. For many people, we have to individualize that if they've already had a derangement, but the average person can think of it like, I want to keep my joint mobility. I want to take my joints to end range on a regular basis in all directions to maintain my normal mobility. For colds, we want to wash our hands, avoid being around sick people, etc. And when people get discharged from my care, if they've had a joint derangement as their diagnosis, I want them to understand that we are going to adopt some maintenance strategies just like you would with a cold, but the inevitable return is kind of a foregone conclusion. But I don't want it to be severe enough that you can't self-manage, that you need to seek help again. A lot of maintenance strategies when it comes to spinal joint derangements in the neck, mid-back, or low back, of course, have to do with how you position your neck, mid-back, and low back on a daily basis. Extremity joint derangements are less kind of something we have to be quite as on top of in my experience, but I want people to understand at least their warning signs. So by making this analogy, I really want to decrease people's fear, tell them how common these things are, tell them how usually once you kind of learn what's going on for your particular derangement, you can self-treat down the road and not have to return to a medical office. Now, if someone has a shoulder joint derangement 1 year and 5 years later has a knee joint derangement, they probably won't understand kind of the process of self-assessment and self-treatment because it's a different joint, but they may have picked up some pointers that do help. So in those situations, of course, seeking a book or seeking a clinician who understands repeated movement testing and repeated movement treatments as a possibility would be fruitful. But if you understand that there are thousands of joint movements a day in our lives, when our joints are not moving, they are positioned in a certain position. They are positioned in abduction. They are positioned in rotation. They are positioned in flexion. If you understand that they're constantly being asked to do something, then you'll understand the idea that it's common for things to get tweaked. Usually they're not presenting with very severe symptoms or very severe signs, but sometimes they can. But in the large majority of cases, they can be reversed relatively quickly, days to weeks, once we find the direction that we need. The problem, of course, is that if you're treating a cold like it's something else, you're not going to be getting effective care or have a realistic expectation of what's going on. And if you're treating a joint derangement like it's something else, like it's a structural problem or a muscle being tight or a muscle being weak, you're also not going to get good results. So reducing fear, understanding prevalence, understanding that these things tend to occur not every year, but every once in a while, and understanding that these joint derangements can largely be self-managed once you know what's going on. I think those are key concepts for patients to understand.